Hello everyone. Today, we're going to walk through something that can feel, well, pretty intense. Pediatric basic life support. But listen, knowing what to do in an emergency isn't about being scared, it's about being empowered. So let's break this down into simple, clear steps that you can actually remember.
Just take a second. What would you do? It's a tough question, one we hope we never have to answer for real. But having a plan, knowing the steps, can change everything. And that's exactly what we're going to build right now, together.
All right, first things first. Before you do anything else, you have to figure out if the child is even conscious. This is your number one most critical check.
So how do you do that? You use your voice and a little bit of touch. Gently tap them on the shoulder or maybe the bottom of their foot if it's a baby, and ask loudly, "Are you okay?" Now the key word here is gently. The guidelines are really clear on this. You're not trying to cause pain, and you should never ever shake a child. You're just looking for any kind of response.
Okay, so what if they don't respond? The next step is non-negotiable, and you have to do it fast. You need to get professionals on the way. Seriously, this single action can be an absolute game changer.
First, just shout for help. You never know who might be nearby. Then get on the phone and call your local emergency number right away. And here's a pro tip right from the guidelines: put your phone on speaker. That frees up both your hands so you can start helping the child while the dispatcher talks you through everything. They're trained for this, so listen closely to what they say.
And now we get to the heart of it all, CPR, cardiopulmonary resuscitation. I know, it's a mouthful and it sounds intimidating, but it's really just a sequence of two things: giving breaths and doing chest compressions. And trust me, you can do this.
This right here, this is the most important difference you need to understand. For adults, a cardiac arrest is usually a heart problem, but for kids, as the slide says, it's almost always a breathing problem that happens first and then leads to the heart stopping. That's why the whole sequence for kids is different. We have to get oxygen in them, and fast.
So to get that oxygen in, you have to open up their airway. And this shows the difference perfectly. For a baby, you keep their head in a neutral position, just straight. If you tilt it back too far, you can actually block their tiny airway. For an older child, you gently tilt their head back into what we call the sniffing position, kind of like they're sniffing for cookies in the air.
And here's your first magic number to lock away in your brain: 5. Before you do a single chest compression, you give 5 initial rescue breaths. Why? Because, again, it's probably a breathing problem, so we're tackling that head on. 5 breaths.
Now, how you give those breaths is a little different based on their size. For a tiny infant, your mouth covers both their mouth and nose to make a good seal. For a bigger kid, you pinch their nose shut and cover just their mouth with yours. For both, you give a steady breath for about 1 second, just enough to see their chest visibly rise. That little rise is your proof that the air is going in.
Okay, once you've done those 5 breaths, you switch gears immediately and start chest compressions. The motto here is simple, and you've probably heard it before: push hard and push fast, right in the center of the chest. So how fast is fast? Well, you're aiming for a rate of 100 to 120 compressions every minute. If you need a rhythm, think of the beat to the song Stayin' Alive. Now, seriously, it's the perfect tempo. And how hard do you push? You want to press down at least 1/3 of the depth of the child's chest. I know that sounds like a lot, and people worry about hurting them, but shallow compressions just don't work. You have to push firmly to get that blood moving.
For an infant, this is the best practice method. It's called the two-thumb encircling technique. You wrap your hands around the baby's chest and use your 2 thumbs to do the compressions. This is way more stable and effective, and it's also less tiring for you.
For a child who's over a year old, you've got options, and it really just depends on their size and your strength. You can use the heel of one hand, or if they're a bit bigger and you need more power to get that 1/3 depth, you can use 2 hands, just like on an adult. The most important thing isn't which technique you use, it's that you're getting the right depth.
All right, now for the rhythm. You'll hear about 2 different ratios. Now don't let this confuse you. Officially, trained rescuers often use 15 compressions to 2 breaths. But for pretty much everyone else, especially if you're on the phone with a dispatcher, you're going to use a 30-to-2 ratio. It's easier to remember, and it's still super effective. Just follow the dispatcher's lead. They'll keep you on track.
Let's pivot for a second. What if the breathing problem isn't a medical issue, but it's because something's stuck? Choking is a really common emergency, and it has its own set of rules. The first thing is spotting it. If a child can't cry, cough, or make any noise, that's a huge red flag.
So if they're conscious but clearly choking, your first move is to get them to cough. Cough it out. If that's not doing the trick, you start a sequence, up to 5 really sharp blows with the heel of your hand right between their shoulder blades. Then you switch to up to 5 thrusts, and you just keep alternating, back blows, then thrusts, until that object pops out.
For babies, this technique is very specific, as you can see here. You lay the infant face down along your forearm, making sure to support their head, and give those back blows. Then, you flip them over onto your other arm and give up to 5 chest thrusts, right where you do CPR. Now, this is so important. For infants, you never ever do abdominal thrusts, only chest thrusts.
For an older child, it's a bit different. You'll have them lean forward while you give the back blows. Then, you get behind them and perform abdominal thrusts, what most of us know as the Heimlich maneuver. You'll make a fist, place it above their belly button, and give sharp pulls inward and upward.
This is the biggest turning point you have to remember. If a child who is choking loses consciousness and goes limp, you stop the back blows and thrusts, the game has changed. You immediately lay them on the ground and start CPR, beginning with chest compressions. And every time you stop to give breaths, you'll take a quick look in their mouth to see if you can spot the object.
Phew, okay, I know that was a ton of information, but it all comes down to just a few key actions. And just knowing these steps means you're prepared. It means you can be the one to make a difference, and that's an incredibly powerful thing.
So let's boil it all down. If you remember nothing else, remember this 4-step sequence. First, check for response. If there's nothing, call for help. Then, and this is the key difference for kids, give 5 rescue breaths. And finally, start chest compressions, pushing hard and fast. Check, call, breathe, compress. Say it with me. Check, call, breathe, compress. That's it. That's the chain that can save a life.
Look, at the end of the day, all these guidelines are just information. They only become life-saving tools when someone like you is ready and willing to use them. So the real question isn't just about what you learned today, it's about being prepared to put it into action. Thank you so much for joining me.